Well, welcome back. Thank you again for continuing to be with us today. I am incredibly grateful to be kind of the interlocutor and introducer of kind of what we're about to see, although it is painful gratitude. As we've already discussed, Arkansas now has the highest maternal mortality rate in the country. We have long been among the highest, and now we have the ignominious place of being the highest. And I am so profoundly grateful to my dear friend, Christy Turlington Burns, for sharing her enormous talent and heart kind of with Every Mother Counts and her spotlight and kind of bringing all of that love, compassion, kind of purpose, care, and light to the challenge here in Arkansas, and also to those on the front line trying to ameliorate the challenge and to provide care to women whose lives are in that gap. And so I'm proud to now kind of share the trailer for the most recent installment of Giving Birth in America from Every Mother Counts, the organization that Christy founded kind of many years ago. And its most recent installment is focused just right here in Arkansas. So please watch the trailer.
Since I've been pregnant, I haven't actually went to any kind of birthing classes. I've been pretty stable, even without the meds. Are you gonna miss me? I'll be back. I have to have a baby.
You ready? I'm ready. I'm waiting on you.
I am 39 weeks.
It's a girl in your belly.
In the postpartum, access to mental health care is a national problem.
Some of it has to do with the lack of access to services, when they don't have supportive networks of care.
Did you have a good day?
And I think the whole system ends up suffering because of it.
Hey, Pumpkin. You ready for Mom to come get you?
It's been hectic. Last night, she didn't sleep at all.
Last year, my mom passed away, and I knew that I wasn't gonna have that support system like I did when I had my son.
I feel like I returned to work a lot earlier, but I needed the money.
She's yawning a little bit. Having a baby in NICU is like going through the different stages of grief.
When women have concerns about their bodies or concerns about things that are going on with them, they need to be heard.
I guess there's gonna be a certain point where I'm gonna have to go back on my medication.
People will come by, oh, let me see the baby. But nobody says, let me come see the mom.
I just wanna lay down.
You just feel so many different emotions.
My job does not offer maternity leave at all.
Is you're still adjusting to being a mom of 2 kids and having a work-life balance.
Mental health services and mental health support is extremely important.
Women should have a say in what happens with their health care.
Is there anything that you need from me at all?
If I could wave a magic wand, every woman would have access to maternity leave. That's what healthcare in Arkansas would look like.
I love you.
It's validating the moms, listening to the moms, helping them find solutions. Because, girl, I'm gonna fight. I'm gonna fight with you. I'm gonna fight for you.
And now please join me in welcoming to the stage Christy Turlington Burns, founder and president Every Mother Counts, and whom you saw in the video, Dr. Nirvana Manning Chair and Associate Professor, Department of Obstetrics and Gynecology at the University of Arkansas for Medical Sciences. We're just going to share microphones. We're talking about building community, and we're doing that right here on the stage. Dr. Manning, I hope that we can, start with you. We've made, many references, and we saw in the film, the very stark statistic in kind of black and white that Arkansas has the highest maternity mortality rate in the country. What does that mean?
So thank you, first of all, for having us here. This is such an inspirational group. I'm honored to be a part of it. I have had the opportunity to be a part of kind of that maternal health movement and really learned a lot over the last several years on what the state of healthcare in Arkansas is. And I will say, as with most rural states, we have an access problem. We have 37 delivering hospitals in the state of Arkansas now. That's already down from 39 at the beginning of the pandemic. We need every one of these delivering hospitals to be able to provide the care for the patients throughout our state. We need to equip, so when we're talking about maternal mortality, this is not common. We started Maternal Mortality Board in the state of Arkansas in 2019 after the legislative body approved it, which we are so thankful for. And I sit on that committee, and we get to review every one of those maternal deaths. And in 2020, there was 30 maternal deaths, and that's defined as from birth to 365 days of life. So as we look through each of those cases and really break down, you'll see statistics like 92% were preventable. Those are astounding statistics. And it's not what you would think. I would hope that a suicide is preventable. I would hope that an untimely death due to a maternal condition that didn't get addressed in the postpartum period because of lack of coverage is preventable. So when we talk preventable, it's individual, it's hospital, it's community, it's all of us. And so having access to those hospitals for these really never events and equipping these hospitals with the knowledge, the policies, the protocols, the standardization to deal with these real time is one of our biggest obstacles.
Christy, I wonder if you could first share kind of why you started Every Mother Counts, and kind of what brought Every Mother Counts here to Arkansas, where it is so painfully clear that not every mother counts as much as she should.
Likewise, I'm very honored to be here with you all. Thank you so much. I became a global maternal health advocate the day I became a mother. In 2003, after I delivered my daughter Grace, I experienced a postpartum hemorrhage. And that experience, where I was fortunate enough to have a great team of providers who worked very closely together to manage the complication that I experienced, changed my life. I came home and my first thought was, what about all of the millions of girls and women around the world who don't have access to that care, who don't have access to the kind of care where someone can recognize what is actually happening, to be able to make the mothers feel supported in that moment so that they don't feel as scared and traumatized as we do when things don't go as planned. And so I wasn't sure exactly how that was gonna unfold in my life going forward, but it pushed me to going back to school to pursue a master's in public health, and then to look at this issue and use my voice and my story to the ability that I could. That led me to make my first documentary film, which was called No Woman, No Cry, and we looked at challenges women face around the world in Tanzania, Bangladesh, Guatemala, and here in the United States, with an angle on the sort of what is possible. Because 90% of deaths globally are preventable, we know what's needed to save moms' lives. We know what's needed to keep women and birthing people safe through pregnancy and postpartum. But we haven't made the commitment at the global or national level that it is the priority that it should and must be, especially with the ranking of this state and this country, which is the only, as was said earlier, high resource country with a rising maternal mortality rate. It's just unacceptable.
And Christy, why did you turn the attention of Every Mother Counts and kind of your platform, your voice, here to Arkansas specifically?
I mean, the ranking really was what opened our eyes. We have made 6 films previously looking at maternal health and mortality, actually, in Florida, California, New Mexico, Louisiana, and New York. And when the most recent ranking put Arkansas at the top of that list, it felt the time was now. My team came down over a year ago to start meeting with folks like Dr. Manning and other experts, community-based experts on the grounds. And we had identified these amazing, amazing women to be able to start to unpack why the state is struggling. And the rural nature of the state is a big part of it. Hospital closures. A lot of these things are happening in many other states. They're happening nationally. There are provider gaps across the country. But when we look at who is accessing, who is not accessing, and what the quality of care looks like for those who do access it, this is the opportunity here. And then the postpartum period being, I think, a part of the conversation that has only recently come to the forefront and that there is momentum on, which is very exciting. This film especially focuses on the movement to extend Medicaid coverage to a full year postpartum, which, for those of you who don't know, 50% of maternal deaths happen after the baby is born, between 7 days and a full year. So this is a critical time where you can't just stop caring for women and families. You need to continue that care to ensure, again, for the mental health side of this conversation, we need to look after moms. We need to support them for many days after the baby is here.
You know, Dr. Manning, you spoke about 92% of the maternal deaths being preventable, which is just a kind of gut-wrenching statistic on top of an already kind of achingly painful one. And all of the different kind of things that need to happen to kind of prevent every one of the preventable deaths, that there isn't just sort of one way that one provider or one hospital can operate differently, that so much needs to happen. And yet we know so much is happening in other places around the world to prevent every preventable maternal death. How do you see us getting from kind of where we are here in Arkansas to where we need to be to help ensure that every mother's life does count, you know, while she is expecting, as she's delivering, and in that critical year following?
No, thank you for that. I think that's a great question. What needs to happen? I wish that was an easy answer. I think it's super multifactorial in that some of the things that we are doing, the Alliance for Innovation in Maternal Health Care, it's AIM, we just joined. We are the 48th state to join AIM, and we just started that about 3 months ago. And what that creates is a network within our hospitals, our delivering hospitals throughout the state, to do some of these educational things that we know have been validated. The California Collaborative Bundles, and there's bundles in healthcare. Luckily, we live at a time that we don't have to wonder what the best way is to take care of a postpartum hemorrhage, of preeclampsia, of some of these really scary never events. We know how to take care of it. We just need to disseminate that information to all of our delivering hospitals to make sure that if they are delivering one of these a year, they know how to act quickly, they know how to act swiftly, they know that there's resources that will help them, and we can help support those hospitals, those providers, those nurses that may be turning over really quickly. So that is one, I think. Community healthcare workers are just so needed in these communities. As we talk about rural Arkansas, and there may not be a hospital within 50 to 100 miles for a mom, we need people on the ground that can help coordinate that care, that can escalate that those concerns. We have to listen to these moms. I mean, we know there is a racial disparity. It's unacceptable. The statistics I think I read just recently with college-aged Black women, they are 5 times more likely than their counterparts to die during childbirth. That's unacceptable. So why is that happening? And I think we need to just break that down. I think there is a distrust in the healthcare system, and we need to figure out how we can address that. And really, that starts years before. I mean, I think we need to get more Black healthcare providers. We need people that, as I think Camilla Harris, look like me, to take care of me. We need to start that in early education, in the colleges. We need to help support these young girls in any way we can. I think we have to kind of look at our implicit and biases and really say, why are we not listening to moms? And if they're not being listened to, how can they help escalate that? How can we get them the care they need when the provider that they're talking to may not be listening to what they have to say? So I think there's tons of great work that we can do on that. It's going to take a lot of effort, and I think it's well needed, and I think the momentum is there right now, especially in the state of Arkansas, to help women be safer and take better care of themselves and their families.
Christy, you spoke about the maternal mental health crisis that for so long has been somewhere on the spectrum between being kind of ignored and dismissed or underappreciated. Why do you think there is now more of a conversation about kind of maternal mental health, and how do you think we continue the work of destigmatizing expectant and new moms and parents, talking about how they're feeling, talking about and even being able to access how they're feeling affecting their kind of physical and whole well-being? Because we know that while, of course, kind of Medicaid should cover not only a year postpartum, but the entirety of someone's life is needed. And of course, we need more providers and kind of clinics and hospital infrastructure. Stigma is real and deadly in public health, and that includes in maternal health.
I mean, the power of sharing our stories cannot be underestimated. I think there have been some very brave, very moving stories around people's suffering through postpartum. And it's allowed more of us to say, oh, well, maybe I did have some experience on the spectrum of what that is, because it's a spectrum like all things. It's not always the most extreme scenario that you might see in film and in TV. But I think by hearing more of those experiences and by sharing, and this goes across everything in our reproductive lives, really, sharing our birth stories, sharing our healthcare provider stories when we have a positive experience, sharing to our friends and our neighbors and our community members what that experience was like, what to expect for ourselves and what to demand. Mental health, we've seen, I think, through this pandemic more than ever, just how prominent it is. And of course, like anything else, in pregnancy, things can be exacerbated, right? Our hypertension can suddenly present itself. Diabetes can present it. Like, there are all these things can happen during that time, and you don't know necessarily how your body will respond or react when pregnant the first time. And so we need more opportunities for providers to be trained in the whole scope of care, understanding the continuum and where mental health comes into play, and having more people trained to be looking at talking to women before conception, through their pregnancies, delivery, postpartum, because we're more able to address where they're at if those relationships and that trust has been established in the process. And then that allows us to better care for and look after them postpartum. It's the continuity piece that I think is so important. When I first got involved in this work, I learned that piece of it. And as my children have grown, and my daughter is a 19-year-old woman, it's that intergenerational, it's that continuum of care, it's that ancestral piece, that cycle. We need to pay forward what we learn, what we hear, and share that information so that we can better prepare ourselves for whatever could happen.
Mm-hmm. Dr. Manning, how has COVID and the experience of COVID, over the last almost 3 years, made your work harder?
Oh, goodness. We work at the University Hospital, and we are we have a level 3B nursery, which means we take care of the very smallest, the very sickest babies. And there's not many places that can take care of that in the state. So as we have seen hospitals closing or nursing shortages, as we know are so prevalent, and hospitals not being able to open their beds, we know that we cannot be all things for all people. And I think that's become very evident, that we want to be the things that we can be for the patients that really need us. And how can we best create a network with which patients can get to the right place for the care that they need, with the subspecialists that they need, that can take care of that baby best as they can. I think that's where a lot of our efforts are now focusing on. And it's things that we didn't necessarily think about prior. But it's really jump-started the last 2 years how much that is going to be needed for our community. Because in these 37 remaining delivering hospitals have got to remain open. They've got to remain open for the patients in these communities.
Christy, how has the Dobbs decision and kind of the restriction or the elimination of abortion rights in so many places across the country, including here in Arkansas, how has that influenced, if at all, the work of Every Mother Counts?
I mean, our focus is still very much the same in the sense of centering women's experiences and voices and trying to grow the pipeline of providers of care, the whole ecosystem of maternal health care. But from listening to some of our community-based partners more recently and talking to them about what they're already seeing, we've heard some shocking things. There are women that are opting in to, now I'm blanking on the word, to consciously not have to sterilize, to opt into sterilization, self-sterilization, to be able to have some control in their reproductive health and lives. That shocked me. In Guatemala, where we also have grantee partners, they were telling us that the number of men who have signed up for vasectomies has increased in these last few months. That's a good thing. I think we need more of those men telling their stories. But that's how we operate as an organization. We really very much rely on the expertise and the knowledge from our partners that are on the ground in their communities in whatever state or whatever country that they're in. And so by talking and asking those questions, what are you seeing in this moment, and how can we support you, whatever that might look like. I think we're only just beginning to see, and I think a lot of the worry and the concern around legality for providers is very top of mind. And just the unclarity. It's very hard to just differentiate what is real and what is not real, what might be real for someone you might be talking to in a different state, and then what is that reality in your state. It's a confusing time, and I think that's something that I hope we can become a bigger voice in helping to navigate what is real, what is truthful, and as it's changing constantly, to stay at the forefront of that.
And Dr. Manning, how is the Dobbs decision, and then rather immediately what happened here in Arkansas, affecting your work?
So we know that half of all pregnancies in the United States are unplanned. That is a fact. That is a statistic. So now I think it has really taken our focus as providers. I mean, certainly we want to be able to provide the best care for our patients. Our hands are a little, we have to be a little bit more ingenuitive about it. Certainly with regards to some of the discussions starting significantly earlier about contraception. I think you said it best when you were talking about your middle school days, and there was education that was provided in our schools, and I think we need to start talking to our young people in just much more frank, realistic ways on how to make good choices for themselves, what it means to be good stewards of their own bodies and to take care of themselves when no one else is going to be looking out for them. So I think it's taken that conversation for us and our providers. How can we better provide contraceptive care and education to our children? How can we provide it in the postpartum period? I think it's very poignant that, half of our pregnancies are on Medicaid. Medicaid coverage stops at 60 days. And so for anyone that's had children, been a mom, any of that, we're still upside down at 60 days. We're not thinking about the future. We are trying to survive. And so extending that coverage such that women can get contraceptive care, women can get preventative care, such that when they do become pregnant and choose to become pregnant again, they can be in the best state of health for that next pregnancy. And they can plan their pregnancies and the spacing of those such that they want. I think those are the big ones.
Well, thank you both so much. And I do now want to ask kind of each of you for your call to action for everyone here and everyone who's joining us virtually. Dr. Manning, you look ready. So I saw you pulled out that sheet of paper. So ma'am, I'm gonna start with you and then we'll go to Christy.
I will say for anyone that has not looked, there is a website called safehealthcareforeverywoman.org. And there are opportunities on that site for individuals, for communities, for any kind of group to engage. I think that is the take-home message. Engage your community leaders, engage your legislators, engage your communities and neighbors to think about women before, during, and after pregnancy.
And mine, please go to everymothercounts.org and check out the Giving Birth in America series. We would love for you to join us in advocating for quality maternal health care and birth equity here in the U.S. and globally. And we have a wonderful advocacy toolkit as well that's on there.
Well, please join me in thanking Christy and Dr. Manning for everything they're doing and for joining us today. Thank you all so much. Thank you.